I'll be talking about only one condition and what is different that we are doing here compared to the Indian national level. Okay, so we have just an overview of what we have been doing is, this is the shoulder bone and this is the muscle which attaches onto the bone. Alright. Now in most of the conditions, this elderly people aged 60 years or above, they have pain in the shoulder which may be due to injury or due to sudden jerky activities. When they try to lift something heavy, all of a sudden this muscle tears up. Okay, and they have severe pain.
This is a muscle or a ligament?
Muscle.
Unlike the knee.
Yeah, this is muscle. Shoulder is muscle. Now, what happens to them is, after they develop this injury, knowingly or unknowingly, they'll have a lot of difficulty in doing overhead activities. They can do all below shoulder level activities, but to lift it above the shoulder and take it to the head for the wash and undress themselves, they'll have severe pain. Right? Traditionally, we have been doing as an open surgery. We open it and then we fix it onto the bone with something called anchors. Okay, we colloquially call it as screws. There are different types of screws, metal screws. Now we are using bio screws which dissolves in the bone. But the problem with these things is it's extremely costly. So the minimum price of one bio anchor is approximately 15 to 20,000 rupees. In one person, a minimum of 2 to 3 anchors will be used depending upon the size of the tear. Which means for one, even if you are using one anchor, the cost of 15,000 is high. And when we come across a lot of patients and we advise them surgery, now with arthroscopy being the advanced development, arthroscopy has its own advantages. The best thing is early recovery, pain is less, and they'll be able to move their shoulder pretty quick compared to the open surgeries. But when we do arthroscopy, we were able to use only the anchors to fix it. We didn't have any device. Okay, so what happens? Arthroscopy itself costly, and in addition using the anchors much more costlier, and patients were moving out. They were not willing for surgery, not getting operated. At the end of 2 or 3 years, they won't be lifting their shoulder. Now what we have got is a device called tensor, which is nothing but you use this device and make holes in the bone and simply pass threads and tie and use the thread and tie it onto the bone, which means it's an implant free technique. So there is nothing inside the bone except for threads. Most important thing is very economical. So for example, if one patient needs arthroscopic surgery and we are going to use 2 anchors for them, the cost of anchor itself will be 30,000 rupees. Whereas if we use this device, the cost the patient is going to bear is only for the thread. The thread will cost hardly 3,000 to 4,000 rupees. So we are economizing the type of surgery for them. So this is going to be a revolution. And all below socioeconomic status patients will also be affordable for arthroscopic surgery with this device. Now that first outcome is the pain which occurred due to the muscle tear will go off immediately. Second thing is we immobilize them for a period of 1 month, which means we have to give time for the muscle to stick onto the bone. We are just stitching it, but it has to stick. So it takes 1 month. So until 1 month, they will be wearing this belt. It is very comfortable for them, just around the waist. They can travel, they can do their job, and young patients, they can start doing their computer job, everything. And after 1 month, we remove it. We start with assisted exercise, which means they use the opposite normal hand to lift it up. And usually by 3 months end, they'll be able to lift it up completely pain-free and fully functional. So ideally 3 to 4 months time, they'll be completely functional.